Hello everyone, welcome to Aanvii hearing. Today I'm going to talk about tinnitus, causes, symptoms and treatment options. Tinnitus is defined as noise that originates within the ear rather than from outside sources. This could impact one or both ears. However, it's crucial to understand that tinnitus is not an illness but rather a symptom or side effect of other diseases you may be experiencing. It's also crucial to note that while tinnitus is commonly linked with a ringing sound, it can manifest in a variety of ways. Tinnitus can be described by some persons as a buzzing sound, a clicking sound, a roaring sound, or a hissing sound. Here's more in-depth look at what tinnitus is and how it can be treated. What causes tinnitus in the first place? Tinnitus, first and foremost, is a subsequent outcome of various probable circumstances rather than a sickness in and of itself. Tinnitus can be caused by an ear infection, an ear blockage, or even a medicine that you're taking. Tinnitus, on the other hand, is most commonly caused by hearing loss. Tinnitus is assumed to occur as a result of the brain filling in information gaps caused by impaired hearing with its own noise, or receiving erroneous signals from the ears or misinterpreting the signals it gets. Fine hair cells within the inner ear that transfer sound waves to the brain are damaged in situations of hearing loss. This causes either incorrect signals to be transmitted to the brain or gaps in hearing, which are subsequently filled in by tinnitus. Is tinnitus consistent? Tinnitus is not always the same in the manner that different people feel it, in the severity of the experience, or in the frequency and duration of the experience. Tinnitus might not only sound different to various people, but it can also range in severity from a little nuisance to a condition that impairs one's ability to work and do daily duties. Tinnitus does not always last eternally. Tinnitus can come and go in waves for some people, or it can last only for a few seconds at a time. In fact, short term and transitory hearing impairments, such as a momentary blockage of the ear canal, can induce short term tinnitus. Tinnitus can affect one or both ears, be low or high pitched, constant or intermittent, and be mild or severe. Tinnitus in any event always indicates an underlying reason, so it's a good idea to schedule an appointment with an audiologist if you observe any degree of tinnitus. Tinnitus is treatable. Tinnitus can be cured in many cases after consulting with an audiologist. If your tinnitus is caused by a clogged ear or something similar, the problem can sometimes be remedied after consulting an ENT doctor. If you have tinnitus as a result of hearing loss, there is a significant probability that you may find partial or complete relief after being fitted with an appropriate hearing aid by your audiologist. A well placed hearing aid will amplify specific sounds in specific bands that you don't hear clearly, assisting your brain in processing that sound's information rather than filling up gaps in perception with tinnitus. In circumstances where a hearing aid does not resolve the tinnitus experience, one alternative to consider is a sound masking device, which helps to counteract and cover up the tinnitus noise with a more pleasant external sound. Sound masking devices can be worn behind your ear or are tabletop machines that play noises ranging from white noise to nature sounds, music, or other ambient sound effects. Can tinnitus be avoided? Since hearing loss is the most common cause of tinnitus, taking efforts to safeguard your hearing can frequently prevent it from occurring in the first place or from worsening over time. Good general hearing protection practices include when you are exposed to loud noises such as during concerts or when working in an industrial setting, always wear high quality ear protection devices. When listening to music or watching films using headphones or earbuds, avoid utilizing high volume settings.